Hello, everybody. Welcome. Welcome to another Vegan Primary Care live session. This is Dr. Scott Harrington coming to you live from my doctor's office at veganprimarycare.com, where you can see a vegan doctor as your primary care doctor from the comfort of your own home from most U.S. states. Even if you do happen to live in Florida, I'm also open for in-person visits Fridays in Pinellas Park, Florida. That is just north of St. Petersburg. Come see me, not just for a one-time consultation, but as your primary care doctor, someone who gets to know you and someone who can be your health advocate. Because I'm licensed in most U.S. states, even if you move, you don't have to change doctors. If you're vegan, then get a doctor who gets you. If you haven't adopted a plant-based diet yet, you are still welcome to be my patient. But beware, a healthy vegan diet, exercise, and lifestyle changes will always be my first recommendation. My goal is to help you take control of your health. And through a power of healthy lifestyle, we will work to heal your chronic conditions with the ultimate goal of helping you come off your chronic medications. For my patients who cut out animal products altogether, you will not only be helping yourself feel better, but you will also do your part to stop animal suffering and to decrease the impact on the environment. In other announcements, we also offer vegan primary care patients free weekly check-ins with the Get to Your Goal weight loss meeting. It's a weight accountability visit on a private group Zoom meeting, Tuesday nights on 7 p.m. Eastern. Remember that this content is for educational and entertainment purposes only. This video is not intended to take place of your own doctor's advice. Okay, we are live streaming to multiple platforms and ready to take your questions. Hi, everybody. If you're just joining me right now, go ahead and smash the likes. Smash the likes if you like what you hear here at Vegan Primary Care Live. I've got a big announcement here. I am now lifestyle medicine certified. Lifestyle medicine certified. So yay, I did the American College of Lifestyle Medicine, did their course, and now I am double board certified in family medicine and lifestyle medicine, which includes the 6 principles of lifestyle medicine, including exercise, diet, sleep, avoiding toxins, having healthy relationships, and stress reduction. So that aligns with my philosophies here in family medicine, and so I was glad to get additional training with that. So that is really good. Okay, we've got, thank you, everyone. Thank you. I feel like patting myself on the back. Okay, we've got Tamara Sergi. Hello from me and Mom. How's it going? Okay, we've got Jacqueline Rose. We are so thankful for vegan primary care. Thank you. I'm happy for you. I appreciate you. Okay, all right. Hello, Dheeraj Taranath. Good to see you. Hi, Doc. What's your opinion of gluten? Any issues if you aren't otherwise intolerant or have celiac disease? Okay, well, thanks, Dheeraj. This is a good question. My answer is, if you don't have known intolerance or celiac disease, that I recommend to go ahead and eat wheat products and gluten-containing products. The big concern is the idea of them not being whole. Whole is better. And so people who have various bloating and wasting problems, they're bloating and they're having diarrhea and abdominal pain, and they're having liver inflammation of unknown cause, then it is important to test people for gluten intolerance and gluten sensitivity with celiac testing. You have to actually be actively eating gluten and having a gluten reaction in the gut for the test to come back positive. So, and one of the ways to try to test this out is to stop eating gluten and seeing if the symptoms go away. And then do a re-challenge of gluten. So most people will just kind of stop eating gluten, kind of if they have sort of an inclination that this might be a problem, and they stop, and then they're kind of fearful about going back. So to cinch the diagnosis, it is good to do sort of a gluten challenge. But let's go back to the idea of whole. You know, breads and pastas and these kind of foods kind of get a bad rap, and they get a bad rap because the whole grain, the grain part has been stripped off, and we just have the internal part of the grain, which contains the carbs, and then it's ground down, and then it's just really highly absorbable. So what you'll find is that the more processed of a food that you eat, the worse you feel, the worse it makes you feel. Like if you eat a bagel, it is a little bit, you know, you do get energy for a while, but then you will get a crash, as opposed to if you eat a serving of brown rice or oat groats or, you know, quinoa. That just kind of sticks with you. It's a log on the fire versus paper on the fire. And so I think when people are feeling bad relating to carbs and grains and breads and things like this, it's mostly because of the fact that it's processed, and you get the high glycemic spike, and then you get the insulin spike and the sugar crash. And so just like the idea that we've all heard about with candy bar and this kind of thing, the same thing happens with carbs. However, this doesn't mean that carbs should be off the plate. On the contrary, eat your grains as whole grains, and you just feel so much better. It is like a solid energy all throughout the day. This brings up the point about the ileal break. The ileal break. Dr. Greger introduced me into the ileal break in one of his videos, and I got to tell you, I think this is one of the most amazing things for the reason why this works. The reason why whole grains make you feel full for longer. And what it is the intestines is like a conveyor belt. The small intestine is like a conveyor belt whose job is to absorb all the nutrients from your food. And by the time it makes it all the way down to the end of the small intestines, the terminal ileum, it makes it all the way down. There's nutrient sensors there that can tell if there's still nutrients remaining in the food. But if your food is a whole grain or beans, much of the nutrients is still kind of locked up in the fibers, is locked up in those cell walls. And so the body senses that, hey, we don't have all the nutrients out of this. We haven't done our job to absorb all the nutrients. Slow down the intestines, send out a fullness hormone. We need to digest these more. That's what the body does. And so what you get is you get a sense of fullness, and you get a longer more energy, more sustained energy, that you're not having peaks and valleys. So it's just way better to eat. Ileal break. It's the reason why we should all be eating whole foods, and we should all be eating high on the whole grain hierarchy. Okay. Thanks, dear Edge. Okay. Vita Liberata says, I've heard there's concern about nutritional yeast being fortified, specifically regarding added folate. Do you have any advice on that? Should I avoid fortified ones? Oh, you may have stumped Dr. Harrington on this one. In terms of fortification, folate has been fortified in the United States. They're required to fortify grain products with folate. And the reason is because of a rise in homocysteine that people get if they're not getting enough B12 and not getting enough folate. And so for population health, the requirement for this to be fortified, and it decreases the homocysteine in our population. Homocysteine is an inflammatory molecule that builds up. And so the concern for folate might be this concern about folic acid, and I'm not prepared to give you the folic acid concerns, but when you read about it, there's differences between folate that comes from from foliage, from plants, and it's very healthy for you. And people who have high folate levels in their blood and everything tend to be very healthy, and it prevents neural tube defects and these kind of problems in pregnant ladies. But the idea that folic acid, which is stable component and can be taken and turned into folate in your body, could potentially have some issues. So I think that's where we are, and I'm not ready to talk about it because I want to give you the right scoop on the folic acid. So I'm going to write that one down. Okay. So Vita, as far as I know, I think it would probably be safe, and B12 is very important. And if you're getting it with nutritional yeast, that's good. The issue that I have with nutritional yeast is if you have celiac disease or you have, inflammatory bowel disease like ulcerative colitis and celiac disease, or an acne-like condition that creates cysts in the armpits and the groin called hidradenitis suppurativa. If you have these, unfortunately, nutritional yeast has been associated with mildly flaring these things. So if you have these, be careful with nutritional yeast. Okay. Thank you, Vita. All right, Karen. I love spinach a bit too much. I can eat it every day. I found out it can be harmful. Are there any other whole plant-based foods that I should not overdo? Okay. This is a great question, Karen. I need to have this as a blog post. When eating plants is too much, not to overdo. Okay. Well, so what you're talking about, Karen, is the oxalates in spinach and Swiss chard, and I think beet greens and certain greens. And these foods are very healthy, and the fact that they contain oxalates shouldn't discourage you from them. But other greens like arugula and mesclun mix and romaine and watercress and things like this are also very healthy too. And so kale, you should bring these things in, and so that spinach is not the only green that you're getting, because it's very, very, very high in oxalates compared to the other ones. If you've ever had a kidney stone, these are calcium oxalate stones. And so there is a theoretical risk that you could potentially put yourself into a kidney stone if you're, eating bags and bags of spinach every day. So I recommend kind of mixing that up and maybe doing the high oxalate greens only once a week or twice a week, separating it out, spreading it out a little bit if you're doing it twice a week. And so this may be a problem in folks who are doing green smoothies every day and hitting it hard with the spinach. Spinach and these high oxalate greens tend to be sort of a mild leaf that is just mild flavor, and they tend to be preferred just for their texture and this sort of thing. So you kind of got to be careful. You can get lulled into that. So I've actually never heard of an incidence of kidney stones related to this, but it's a theoretical risk because of the numbers. Okay. All right. Other things that are high, I've heard that star fruit have certain high elevations. There's lots of plants that could be potentially poisonous, depending, like for instance, elderberries. Elderberries is something that we eat, but it's cooked elderberries. If you ate raw elderberries, they'd make you sick. Beans are not poisonous, but if you ate raw beans or beans that are not cooked, I believe it's the lectins could make you have upset stomach and could make you vomit. And so these are made inert by simply cooking and rinsing and cooking. And so normal beans and canned beans and things like this that you don't have to worry about it. But there are certain foods, certain plant foods. Plants are powerful. Plants are powerful, and certain ones can have problems. Pineapple comes to mind. Pineapple has an enzyme that is very acidic and can etch your tissues in the mouth and can make you have sort of like a sore throat if you're eating a pineapple that is not super ripe. The pineapple has to be like super stinky and super, super sweet and ripe. If you're eating a pineapple that is more sort of green on the outside, you might get this phenomenon where you feel like an etching of the tissues in your mouth and a sore throat. Okay. If anybody else knows other sort of maligned plants, throw them in the sinister plants. Throw them in the comment section. I would love to hear about it. Okay. Karen Hodgins says, congrats. Thank you so much, Karen. Okay, Jonathan GI. Okay. Providing care remotely. How do you know where to refer someone when specialist care is required? Any issues with those providers coordinating care with you? Okay, Jonathan GI. No, there's no problems. Just like if I was be sitting in my office and I would refer to a specialist, I'm just sitting in my house and I'm referring to a specialist. There's no problems. The question is, can you really do telemedicine for primary care? Is this really a thing? And the answer is, I kind of feel like it's a 95% solution. The exam is the biggest kind of thing that's left out. Although anything visual you can see in the back of the throat. Patients can get these devices with fiber optics, and they can take pictures of their eardrums. They're cheap. They're about $30 or cheaper, and those are really cool. There are devices like the Taito Care device, which I'm not currently partnered with because of the fees. But there's this Taito Care devices where people can listen to your heart and lungs. But what I do is I simply read if there's a problem that we need to bring in like a GI specialist for colon cancer screening or for abdominal pain workup that's unexplained. We just reach out to, oftentimes I use Google reviews to find a provider who's very well reviewed. And I find out if that provider accepts their insurance, and then we just fax over a referral and they make an appointment. So it's easy does it. It's no problem. And everyone's really responsive and they send back the feedback just like at a normal office. All right. Thanks for the question, Jonathan. Okay. Mayoshi Hicks says, congratulations. Thank you. Thank you. If you're just joining us, I got double board certified. I'm now certified in lifestyle medicine. And so I'm very proud of that. And thank you for that, Miyoshi. Okay. Deborah Thompson says, would you prescribe ivermectin 2 times a week upon request? I have a doctor that does. The short answer, Deborah, is no. I no longer prescribe ivermectin because people are overdosing on this, and it's becoming a problem for multiple reasons. In general, ivermectin is a well-tolerated medication, but there are now other medications that are FDA approved for this. Now, Merck and Pfizer both have one that is for prevention and treatment. I mean, you take it if you actually get COVID. The problematic thing lately is how the monoclonal antibodies have been, they've been taken off. I believe there may only be one left. I have to double check. But the most important thing for COVID treatment and prevention is to develop your own antibodies with a vaccination. So yes, if you haven't been vaccinated, I definitely support getting vaccinated. It is the way it works is your body makes its own antibodies to the virus. And what's better than that? As you know, whenever you're taking a pill, it's prevention is worth a pound of cure. And so whenever you're trying to take a treatment to stop a virus or something like that, it's not going to be as good as when your body makes its own antibodies. Okay, Deborah, hopefully that helps. Okay, Tamara Sergi, is sulforaphane supplement the same as eating broccoli? I haven't seen this. I haven't seen studies that show that it was equivalent, and in that case, I would be suspicious. I would be suspicious. So we've heard that sulforaphane is the bee's knees, and it's helpful. And so you get it from cruciferous vegetables. What we talked about at last week that brought up some questions was the idea of the sulforaphane. It is created by when the cell walls of the sulforaphane containing plants like broccoli and kale and cabbage, and Brussels sprouts and cabbage. When you chew it, you're mixing, and you mix the enzymes that help to make the sulforaphane. But if you heat it before you cook it, you destroy the enzyme. And so you need a mix of raw and cooked, or if you do cook it, you want to chop it up real fine and get the mixing that's happening before you cook it, like 30 minutes, 30, 45 minutes before you cook it. The chop and hold method. So broccoli sprouts also have high amounts of sulforaphane, and sulforaphane is one of those chemicals that it's potentially even a tiny toxin that causes what they call hormesis, where the body is sort of adapting to a toxin and creating sort of a healthy outcome. Sort of how exercise is a stress puts on your body, that creates a healthy outcome. But you could exercise too much. You could exercise too much, and you could cause your tissues to break down, and you could have a heat injury, a heat stroke. So the dose is the most important thing. So with sulforaphane, yes, these chemicals cause your body to have reactions that are healthy, and so yes, they're cancer fighting. So definitely, it's something. The cruciferous family of medicines or family of plants is something that you want to make sure is invading your salads and invading your food. Definitely. Okay, Vita Liberata says, congrats. I really appreciate it. All right. Ann Grimer says, hi, good to see you. All right. Do you recommend allergy testing, says Karen Hodgen. Okay. I do recommend allergy testing if people are suffering. If you're suffering and you have a lot of nasal stuffiness and you can't figure out the trigger. If you can't figure out the trigger, then get some allergy testing. And I'm glad you brought up allergy testing, because with allergy testing, there are the gold standard. The gold standard is pinprick testing. And then at the top, they prick you with histamine. That's the control to see if you have a response. This pinprick testing is functional histamine testing and will show if you have a functional response. But what some doctors will get lulled into is to prescribe and test with blood testing. Now, there are a few blood tests for different allergies that have been vetted and are very are evidence-based. And there are a few ones like dairy and shellfish and peanuts. And there's a few. There's like 5. But what you typically get is a list of about 200 different foods and different things, and they will tell you they're too sensitive. They're so sensitive, and they'll say that you're allergic to everything. And this doesn't sit well with me, because if you do those same things and you test them with the histamine test, the pinprick, the gold standard test, a lot of times you'll find that you don't have a response. And so, yes, you could potentially have an antibody in your system, but it really depends on whether you're having that functional, that histamine response. That's when you know that you really should avoid it. So yes, if you can't figure out your trigger for your allergy, definitely get testing. And unfortunately, you should try to get the pinprick testing from an allergist. And so that's the best way to do it. All right. Hey, if you're just joining us right now, or if you've been listening and you're liking what you hear, go ahead and smash the likes for Dr. Harrington. Do it for me, because people will see the video and it helps it a lot. Okay. Okay, Haley Curtis says, I'm worried my vegan kids aren't getting enough nutrition they need. Picky eating and advice for everyday foods to help them somehow. Oh my gosh, Haley, this is a big question. This is a very big question, and it is no one likes it more than seeing your kids eat food and feel like, as a parent, you're like giving them food and hoping they'll like it. And so and we worry about parents. We worry that we're giving them the right nutrition. So the first thing, as a vegan parent, you got to make sure that they're getting vitamin B12. And so I found that the easiest way to do this for kids is to do a spray, or the vegan gummies, which are like pectin based, not like gelatin based. And so you want to make sure they're getting a vegan gummy, at least 100 micrograms, but I would say probably 500 micrograms would be more reasonable, because you'll forget and this and that. So that's important. I also recommend vegan vitamin D3, the same as the adult dose, so 1 to 2,000 IUs. So so those are the main things that you need to worry about supplementing. But in terms of them getting enough calories, the main question is, where are the kids on the growth curve? If they're growing, they're getting enough calories. So you don't have to kind of worry too much. We worry they're picky and they're not eating what we want them to eat. They're not eating like kale all day, but oh, by the way, you're not eating kale all day either. So, but yeah, so the joke is that you should lead by example. You should always, their kids should be seeing you eating the food that's healthy. And so that they get the idea that it's the right thing to do. If you have one of the kids in the family group that is a good eater, make sure the kids see them eating and they'll trust, oh, this food is safe and is yummy to eat. So there are some tricks that you can do to get kids involved with the different flavors. And so one of the tricks is the taste test. The taste test. So this works in two ways. The taste test works in two ways. You want to get the child to taste a certain flavor for about 15 different times. You can't sort of like throw in the towel with the first taste and they don't like it. Nobody likes anything new when they first taste it. They've got to kind of learn it like you're learning a song. First time you hear a song, you're just not really that interested. After you hear it about 10, 15 times, you're singing it and loving it and expecting. So fear of a flavor is kind of like scared of the dark, fear of the dark, fear of the unknown. And so we normally have a sense of distrust and disgust when we are exposed to a new flavor. And so the two ways that you can do is the taste testing. And one is the dips, the 3 dips. So you take like carrot sticks or celery sticks or some, maybe radishes or something, get a little bold, try different things. And then you do 3 dips. And then you have them dip it, say, in mustard or in hummus or maybe in some sort of sweeter sauce. And you have them use like, which dip do you like the best? Meanwhile, they're potentially eating some of the food that you're trying to kind of, it's a Trojan horse trying to get them to eat the food. The other one is making them try the food multiple times by making it such a small piece that it's a tolerable piece. So the idea is, how small would a roach have to be? If you had to eat a roach, how small of a piece of a roach could you put in your mouth and taste it? Consider the food is that disgusting because a child may feel very scared and fearful. And so this is the types of things you're thinking about, very small amounts. So the main thing to summarize, the main thing is the growth chart. If they are appropriate height, but they're really low on the weight or something like that, or they're not growing, that is 5-alarm fire. Make sure you're including liquid supplements like organic soy milk and adding these additional liquid calories that are easy to eat. And so make sure you have healthy foods around and available at all times at eye level, and just allow them to eat at will. And so those are and the other thing is to avoid the garbage, get the garbage out of the house, because if it's in the house, they'll eat it, So those are some quick tips, but I've got a whole website blog on this, how to get kids to eat your vegetables. So go on over there and check it out. Good question, Haley. Okay, Jonathan, GI, an allergen antibody test are antibody test useful, reliable for those unidentified or suspected food intolerances? Okay, Jonathan, I'm glad you asked because I kind of answered it before. You may have put this down before I answered it, but one of the things I worry about with the allergen tests from the blood are they're so sensitive. They pick up lots of things. And then you end up with a big sheet of tells you all these different foods that you're not supposed to eat. And this is problematic. We want to always expand our palate. Just like the thing I was talking about with the kids, we want to be trying foods. We want to be, ordering new tropical foods and stuff. We want to be trying out raw vegetables, greens without dressings and stuff, just to kind of expand our palate and get our palate used to eating these more whole plant-based foods. That vegetables tend to be kind of bitter and they tend to be, not as yummy as fruit. But the more you expose yourself to different things, the better, and you expand your palate, healthy palate. So these kind of tests, I worry because they'll tell you you're allergic to very tremendous amount of food, and then you'll like be constricting your palate to like white rice, and that's it, and that's not a healthy way. So instead of doing the allergen testings this way, I recommend going to the allergist to do the pinprick testing, unfortunately. Good question, Jonathan. DRH says, thank you. All right. And okay, Jonathan GI says, what is resistant starch? Okay. So there's a certain amount in starch. There's a certain amount of, I guess, regular starch and resistant starch. But it's a small percentage in the amount of carbs that are in starch that are in food, like such as potatoes. But there is a phenomenon where you can cook potatoes and then you let them cool. There's a certain amount of, I think what it's happening is polymerization that is happening amongst some of the starches that make them harder to digest. And so resistant starch is a healthy phenomenon that and certain foods contain more aspects of resistant starch. So resistant starch. So the main example is like the hot versus cold potatoes or reheated potatoes, have more resistant starch. So I need to come up with a list and really focus on this. However, because it's sort of a small portion of the food, I think that the resistant starch sort of concept might be a little bit, there might be more weight that we're putting on the resistant starch thing. As opposed to the idea of whole grains, I would put sort of more focus on making sure that you're eating starches and grains that are higher on the whole grain hierarchy, so to speak. Okay, so is a sulforaphane supplement the same as eating broccoli? So once again, yes, Tamara, I would be concerned. I would be concerned that the supplement would not be as powerful as eating the whole food. And I have not seen a study that shows that it to be equivalent. So that is what you would want. You would want to see a head-to-head study with broccoli versus sulforaphane powder or pills. And I don't think that has been done. Okay, what is Keisha Reese Stapley says, what is the difference between a lifestyle medicine doctor versus a regular doctor? Okay. Any doctor and PA and nurse practitioner and other healthcare providers can go and get additional training in lifestyle medicine because it works on top of any other specialty. But in my mind, family medicine is the ideal type of practice to get additional training in lifestyle medicine because that is what we're usually working with. We're usually worried about the typical cholesterol and blood pressure and these things that relate to and have lifestyle cures. So you could have a surgeon who goes and gets lifestyle medicine trained, and that would be a good thing because then they wouldn't be telling you that you have to eat so much protein or whatever. They're it's the dominoes are falling, the cards are falling, and eventually all doctors will be vegan. But until then, you want to have a doctor who is at least trained in this because we know evidence-based wise, a plant-based diet is one of the most evidence-based things that you can do. We may have to start wrapping up because we're getting here a little bit long and I'm getting some messages from my staff that we have some things to take care of. So thank you everybody who's been here today. And I just wanted to say, I'll answer other questions in the comment box later. Thank you so much for your time today, and I look forward to seeing you next week. Stay vegan.